So, let's talk about effects of sympathetic stimulation. These are most easily remembered by thinking of changes in the body that are appropriate in the fight or flight reaction. Note which of the following effects are excitatory and which are inhibitory. 1. Pupillary dilatation, more light reaches the retina. 2. Bronchiolar dilation, facilitates increased ventilation. 3. Heart rate increased, blood pressure rises, more blood for increased activity of skeletal muscles. 4. Vasoconstriction in skin and viscera and vasodilatation in skeletal muscles, appropriate redistribution of blood to muscles. 5. To provide extra energy, glycogenolysis is stimulated and the blood glucose level increases. The gastrointestinal tract and urinary bladder relax. Now let's discuss adrenoreceptors. These are divided into two main types. Alpha receptors mediate the excitatory effects of sympathomimetic amines, whereas their inhibitory effects are generally mediated by beta receptors. Exceptions are the smooth muscle of the gut, for which alpha stimulation is inhibitory, and the heart, for which beta stimulation is excitatory. Responses mediated by alpha and beta receptors can be distinguished by 1. Phentolamine and propranolol, which selectively block alpha and beta receptors, respectively, and 2. The relative potencies on different tissues of norepinephrine, epinephrine, and isoprenolone. The order of potency is norepinephrine more than epinephrine more than isoprenolone, where excitatory responses are examined, but for inhibitory responses this order is reversed. Beta adrenoreceptors are not homogeneous. For example, norepinephrine is an effective stimulant of cardiac beta receptors, but has little or no action on the beta receptors mediating vasodilatation. On the basis of the type of differential sensitivity they exhibit to drugs, beta receptors are divided into two types: beta 1 heart, intestinal smooth muscle, and beta 2 bronchial, vascular, and uterine smooth muscle. Alpha adrenoreceptors are divided into two classes, originally depending on whether their location is postsynaptic, alpha 1, or presynaptic, alpha 2. Stimulation of the presynaptic, alpha 2 receptors by synaptically released norepinephrine reduces further transmitter release, negative feedback. Postsynaptic alpha 2 receptors occur in a few tissues, for example brain, vascular smooth muscle, but mainly alpha 1.